I'm a huge proponent of healthcare reform. I think it's critically important that we have reform, and I think it's critically important that we have reform at a federal level. So I'm quite optimistic about it. I'm quite encouraged about it. I work really hard on it and think about it a lot. I think on the insurance market side, it is essential that we have reform that makes coverage universally available. I think it's an embarrassment. It's a national embarrassment that we have 46 million people who don't have coverage, and we can do better, and we should do better. So I'm an absolute proponent of having coverage very broadly available to anybody who to anybody. I do think that means that there has to be a mandate, and that mandate has to be one that is enforceable and that is effective. But I think that's a key cornerstone. The other part of healthcare reform that is so important is addressing the cost issue. And that cost issue is one that I think we all play a role in. Historically, we've had the health plans blaming the hospitals and the hospitals blaming the doctors, and everybody spent all their time blaming each other. And the fact of the matter is, everybody owns a piece of the problem. Everybody needs to own a piece of the solution. And so back to your question of what are we working on to address these issues, the kind of work that we're leading here in California, building these partnerships and collaborative efforts with hospitals and physicians and with Anthem Blue Cross at the lead, is the kind of effort that will in fact make dollars available so that coverage can be more broadly available. I think it's so critically important, and I'm a bit worried about it at the moment because politics are being played as they often are. But this is such an important issue that I wish we could, and I believe that we will serve an important role in bringing the parties together and focusing on what is it that we need to accomplish and how do we get this done. I don't think it will be, I think it will be good for our organization, particularly if the reform happens at a federal level. If it doesn't happen at a federal level, what we'll end up with is 50 different states trying to solve the problem 50 different ways, and there won't be any coherence, there won't be any organization to it. I think what we'll end up doing then is creating a great deal of complexity and a great deal of expense, and we'll have done very little to solve the problems of providing insurance to the uninsured.